big shout out to all those patients that have been in our waiting room, that talk to other patients that have met our patients up in at the airport, and without knowing, they start talking about Supreme. They're like, well, we're going to Supreme.
So that's very important, the diagnosis, because sometimes we are trying to save teeth because, yeah, for sure that's the best way to go. But we are not heroes. So
yes.
So
we can't do miracles.
Yeah.
Yes, and something very important, we never think as a salesman. It's always we're looking the best for the patients. And also, we have a lot of work. We have a lot of patients here.
Well, when we offer it, we really offer it because we know that it's the best outcome for the patient and for our implants and for the whole procedure as well. Yeah, and something that Dr. Alonso mentioned that's very important, the quality of the zirconium that we use as well. We use Amangirvach. You guys can look it up. Not only just the zirconium itself, the discs, but also the machines. A little story. For Frank and Aida always want the best. Whatever's in the market, they want the best.
It was all a dream. I used to read Word Up magazine. Salt and pepper and heavy D up in the limousine.
Welcome back to Supreme Dental Podcast Studio. You can be anywhere else in the world right now, but you're here with us. We appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Listen, we're on Apple Podcasts and on Spotify. So at any time, you can hear any type of subject, dental related or non-dental related sometimes, that we have to offer. And today we have Dr. Elias.
Hello, Frank.
We have Dr. Alonso.
Hi, Frank.
We have Dr. Ivan, a.k.a. Spooky.
Hi, Frank.
Mm-hmm.
Guys, let's talk about how there's so much to talk about all the time. We can actually, now we're doing that, just so you guys know back at home, that sometimes we talk on this mic for about an hour before we even start the podcast because it's so comfortable. These guys are getting really comfortable on this mic, and it just makes you want to speak about different things. And there's so many things to speak about, but one of the things we want to hit up on is Dr. Elias was talking about, let's talk about the protocols for an All-on 4. Let's talk about the step by step on an All-on 4. Let's talk a little bit about why immediate loads, what's the benefit, and what are they actually. And a patient of ours today asked us about how does the floss, the water pick work, because obviously sometimes our patients have never used the water pick because they use normal floss, but now having hybrids, that no longer can be done. So who wants to start with the protocols on an All-on 4?
I'm gonna start a little bit with talking about Charles. Charles, the patient that we saw today, he came in May before we went to Singapore, and he got the estimate, and we gave him the estimate, and we gave him the regular estimate and optional things that he can get. A little bit on his background, he's an electrical engineer, so he's an engineer. He understands a lot of physics, and he finally came back to do the procedure. And we were talking about his case on Monday, and he's like, I have a few thoughts on the estimate and a few thoughts on the procedure. And I was like, yeah, sure. He's like, I've been watching the podcast, I've been researching, I've been watching videos on YouTube, and he felt pretty informed, and he's like, I think pterygoids and immediate loads is not an option. And he hit it right on the spot, and we're like, and we know it shouldn't be optional. And he told us as well, it should be mandatory. And we delivered the final temporary teeth today after the surgery, CT scan and everything. And he talked to Frank. He wanted to meet Frank as well. And he reiterated what he told us, that the immediate loads must be something that's mandatory. And we truly believe that as well. When we offer it, we really offer it because we know that it's the best outcome for the patient and for our implants and for the whole procedure as well.
Yeah, he also said that because of the videos and how informed he was able to pick us. He's like, that made so much sense to me that I just decided to go with you guys because no one had all that in just one place. So he's actually going to be in the podcast when he comes back for his final procedure. We told him, and you said in 3 months, right?
Yes.
We said in 3 to 4 months when he actually comes back. I said, well, would you want to be in the podcast? And he said, let's do it. He goes, I would love to. So you guys will be seeing him here in the podcast, hopefully in the very near future. But a little bit on that, you said that maybe certain things should not be optional. Immediate loads to me makes 100% sense on why you should have them. Obviously, bone stimulation, bone loss, it's so much less than what a normal denture is. Actually, we were looking at certain things that said that perhaps you shouldn't even use dentures, right?
Nope.
Like conventional dentures when you get implants, because sometimes it's worse than not using anything at all. If I'm not mistaken,
Yes.
correct me if I'm
Yeah,
wrong.
I mean dentures hurt the tissues that cover the gum for the implants, and they start to wear away the gum, and they actually get to the implant. So it's not good. And it's not like we're making this up. I mean, there's research out there.
And we used to have that problem before we had immediate loads. I don't know if you remember, Alonzo, and when we used to have the dentures, and patients used to come in and you'd be able to see the implants right there already.
Yes,
Right.
can expose the
And patients would be like, hey, my implants is exposing, because
Right.
it was always rubbing.
Yes.
It was always rubbing. And with this, when they come back for the second stage, not only is it healed around the abutment or the multi-unit, making everything be a lot smoother and just better work overall for us and for the patients.
Yeah, we can see in all the patients when they are using these kind of removable things and the removable dentures, even if they don't have any implants, always there is a bone loss and gum loss also.
Why is that?
Because all the pressure goes mostly in the area of the gums, in the area of the bone. So every time we are bite down, we are making a pressure in the gums. So there is a bone loss. So that happens mostly when the patient have those implants. When we place implants, there is a bone loss. One of the things most important is preserve the level of the bone by the time. So I think that's one of the things more important to make the immediate loading. We are preserving the bone. And there's a lot of more factors, but one is the...
Yeah, well,
is one of
that number one factor is preserving the bone, meaning your implant's going to be healthier, it's going to be longer lasting,
long term, right?
which is what we want. But attaching to that, you're going to have something that doesn't move around your mouth. Your second phase is going to be so much faster, so much easier, so much cleaner, because we don't have to cut your gum, and then you swell up, and then you bleed, and then patients are only here for about a week. And if you let it heal, it's going to be 3-4 days or more, then you're going to have to be here for 2 weeks. And patients don't want that. So then when we do something without immediate loads, then it's always a risk that their gums might come down a little bit more. And now it gives a bigger gap, but it's not our fault. It's just the way it works. Certain patients is different. And all this can be solved with immediate loads. It's just a smoother process.
Yeah, and no patient should go home without teeth.
No, nobody wants. Also, the use of glue. Usually, the dentures don't hold by itself. They use glue, and that can tear off the stitches, or the glue can get inside of the recently cut surgery. That's why wearing these dentures could be not.
I think at the end of the day, the patient, they never use the...
They never use them.
They never use them.
They always say when they
So-
come back, I hate them.
And that's another con, because if the teeth themselves, the teeth and the bone, they create a stop for our TMJ, right? Our mandible doesn't move forward, but once that is gone, our mandible starts protruding forward, and that's when we start having problems with our TMJ, because any articulation is meant to stop movements that they shouldn't do, and once we don't have the teeth, the jaw keeps on going forward, and then we lose the vertical dimensions. And once the patients come back and we give them the final set of teeth, if they didn't have the immediate loads, they don't know where to bite. Their muscles are just everywhere. So
let me put it more in human human language. And it was just crazy, because we were just talking about this yesterday on one of our WhatsApp groups, and one of our agents asks us, what if they don't have teeth already and they get implants? What is the benefit of immediate loads? Like somebody who comes in with no teeth.
yes.
Yes, we recover the vertical dimension. That's something who was loose during the time without teeth.
Yeah, and with the temporary
Get back
teeth
that.
that we put on, they're not as hard. They're not as solid as the real teeth. So the temporary teeth can wear out until the jaw finds its natural motion of where it's gonna be in these couple of months. Once we put the real zirconium, that doesn't wear off by itself. So it's actually like it's a muscle programmer that's gonna help the jaw find itself where it should be.
And I talked a little bit about like going to the beach and not wearing shoes. And it was with Lucelli.
Yeah.
And going to the beach is not wearing shoes for a week or 2 weeks, and then you just put on your dressing shoes, and you're just like, whoa, they don't fit me. My foot got swollen or something. No, it's that you're not used to it anymore, and this is what happens when you don't wear your dentures. You're not used to having something in your mouth. So the immediate loads is kind of like that sandal in between the shoe that when you put on your final, it feels more natural and it's easier for you to connect and for it to feel normal. She spoke about her dad, that he used to go all the summer without wearing shoes because he's from Cancun, and then here comes school and he would wear his shoes, and he said he could not do it. And it's kind of how sometimes it works similar, but in this particular thing it is. So yeah, and we had going back to what you were saying, Dr. Ivan. I remember those pictures that patients would send us and would say, "Hey, is something wrong?" And they would send us a picture of their stitches, and they're full of the Fix-A-Dent that they would
glue,
use, or any other thing that they would purchase at any type of store. And sometimes they would try to reline them themselves. So then they would purchase different things and maybe do something wrong and maybe affect something here. And next thing you know, well, I mean, they didn't know any better, but we weren't there because they're in New York and they were trying to do their own thing. And now they could have done some complications on their final procedure. And now with these immediate loads, at the most, you have to worry about a tooth falling off because it's something temporary. But we let you know how to reposition it. Or if you can't do it, you go with the dentist back at home. But it's something quick, it's something easy. And it's just to hold you until you come back for your final prosthesis.
Yeah. And that's one of the things more important also, because we know the patients come from far away, and with the removable dentures, they have to come back in 3 weeks and a month after to do the procedure to make their reline. So they have to spend again another ticket or fly. So in there's a lot more travels. So with immediate loadings, if everything goes fine by the time, it's not necessary to come back for a double check. So that's one of the things important also.
Yeah.
So sometimes the teeth, the temporary teeth, they never gonna feel like the permanence, right? The permanence is another history, but this is something they can start to use to it.
Also, these immediate loadings, introduce yourself to the new bite. During all this time of healing process, you're getting used to the bite. Your TMJ, your muscle memory is coming back. And when they get the real ones, it's something similar to the bite of the immediate loading.
And,
Right.
and not just that, is also a lot of times they pick a color. So let's say they want, say BL4 or BL3, and they put it on, then they come back and they're like, you know what, I like them, but I feel that they're too white. So now they're final, they can get them, or the other way around, they can get them whiter or not as white. So it's kind of like a tryout model.
That's true.
Of what your final is going to be. And obviously, like you said, these immediate loads do not reflect. I mean, even though they look really nice, they have nothing to do with what zirconia will look like at your final.
Yes, no, it's completely different. Also, sometimes I used to say you can go crazy with the color when you're getting the temporaries. You can go for something very white. You can see how you look. Then if you decide maybe it's not for me, when you get the real ones, you can still go less
Back to
whiter,
normal.
back to normal.
That's
It's
crazy.
Like you can go crazy with the temporaries.
Yeah, even the shape of the teeth, the size of the teeth, the wider of the teeth. So we have, mostly with the zirconia bar, we have a lot of possibilities to play with
everything.
With everything, correct?
Size,
Yeah.
colors, shapes. Now that we have the lab here, it's just right around the corner. We just
That's
opened
great.
another door, call the
amazing.
technician, take a look.
How has that been? Tell me the transition, because we still work with labs around here, but like zirconia bars now being done at Supreme. Supremedental Lab, and we'll share different clips of you with David and all that. How has that been? Like,
First-
you guys knowing, what have you guys learned that you guys didn't know about lab wise?
First of all, the quality of the zirconia, I think that's completely another step, another history. So we can feel the quality of this material, the zirconia. So that's one of the things very important for the patient and for us also. And well, we have all the tools very, very close to fix everything.
Yeah, any adjustments, anything. It also gives us a better idea of what actually goes on in the lab. Like, sometimes we would go to the lab, but here, guys, like, we're here all day at the clinic, and it wouldn't be easy for us to actually go to the lab and have to come back, even though it's closed. But now that we have the lab here at the lab, we actually go and see the full process. Before, we used to have an idea, but now we see things that we didn't see before. Like we were talking about this morning about the size of the discs.
Yeah.
That yesterday I was thinking, like, I was at the gym and I was thinking, how am I gonna do this disc that's gonna be, and because I didn't know about that before. I would just send it to the lab and go figure it out, guys.
Yeah.
And now that the lab is there, like, I was thinking about this, like, how are we gonna, it's a learning curve for us as well, because it also gives us a better perspective of what we can do, right?
Yeah.
So I think it's pretty cool.
Yeah, and the lab is so close. The lab there, here's the reception. You open the door, you could actually see the lab while you're in the waiting room. You see Supremedental Lab. I mean, obviously you won't see inside the doors, but there it is.
Yeah, and something that Dr. Alonso mentioned that's very important, the quality of the zirconium that we use as well. We use Amangirbach. You guys can look it up. Not only just the zirconium itself, the discs, but also the machines. A little story. Frank and Aida always want the best. Whatever's in the market, they want the best. No. When I came in, I had an intraocular scanner, and it was a wired scanner. And he's like, "Oh, yeah, you like that scanner?" I was like, "Yeah, it's pretty cool." He's like, "I want 2 of those, but I want one that's wireless." And so he always wants the best. Now for the lab, same thing. We have the best 3D printer, the best
Milling machine.
milling machine, yeah, and the best discs of zirconium as well. So because you can go to different places and they're going to be like, "Oh, well, the zirconium is going to be this much and a different price." But there's also qualities in zirconium. It's not just zirconium.
Correct.
There's also qualities as well, and we use Amangirbach.
And I feel that's what a lot of patients don't know. Somebody else says, "Oh, we sell zirconia," and then you're like, "Okay, well, it's the same thing," and it's not the same thing. It's like a car. It has everything to do with the quality, just like clothes, just like everything. And he actually played a joke on me yesterday. He grabbed one of the boxes and he's like, "What does it say, made in China?" And I'm like, "What?" and then he's like, and I was like, "No, it doesn't."
Kidding, right?
But yeah, no, definitely. We always strive to have the best possible toys around, and we have more toys coming in to make everybody be more efficient. But it's fun. But it's fun for sure. Tell me about the procedures. What about the procedures? What is to expect on step 1 of an all-on-4? Step 2, step 3, step 4?
Okay,
Know
so
about it.
so a lot of people come down and they want to get an all-on-4, or they don't know they need a full arch treatment. Full arch treatments can start off. There are 3 main things that happen when people are in what we call the terminal dentition. One, it's either if their teeth are just failing and breaking, and we cannot restore them to give them crowns, and we have to extract them, and we have to do a full arch treatment. The second one, you might have perfect teeth, no cavities, no nothing, but if the gum is bad and it's not supporting the teeth anymore, there's nothing we can do there, right? And the third one is when we have bone loss as well. It's 3 things that make up a full arch treatment: teeth, gums, and bone. So we start off there. We have to identify who's a candidate, who's not a candidate. Once we do that, we talk to the patients, we take a CT scan, we do intraoral imaging. We also look at the patient clinically to see which route we're going to go. So that's the first step. It's the clinical evaluation and the CT scan. Once we do that, we talk to the patient about different options. This is all on the first day. If we decide to go on, and if the patient decides to go on, that's when we suggest to do IV sedation. Trust me, guys, IV sedation is 100% recommended on patients that we're going to do full arch treatment. It's easier for us to do the work, and it's easier for the patient as well. It usually takes us about 2 to 4 hours, depending on the case, how many extractions we have to do. But you're fully asleep while we do the procedure. Once it's done, the patient wakes up. They're still going to feel a little drowsy the first day. Either we take impressions that first day or the second day. Then after that, usually on the second day, we let the first day the patient, they're going to rest because they're still going to feel drowsy. On the second day, we do a couple of tests to figure out if we need to change the vertical dimension, if we're going to keep the vertical dimension. That's always going to be our first test. The second test, we're going to do a try-in to see where the teeth should be, if we like the way they bite, or if we can still make an adjustments. And then that's when we jump onto the final step to set in the temporary teeth, which usually takes us about 2 or 3 days, maybe. And we like the fourth day just to see a follow-up, see how the patient feels, how their bite feels, because some of the patients are going to come in here without teeth, and they don't know how it feels again to have something solid in their mouth. So that's a little overview of the protocol of what we run here at the clinic.
I remember in the past, sometimes, I went for when patients come down and the teeth they look still good, like a 15-50. The level of the bone is not really good, but they are still, they have the chance to try to fix with sometimes root canals or crowns. So in the past, I did a lot of like full mouth restorations, but by the time with more experience, we are those patients come down with sometimes when one of the tooth some mobility, and we try to fix and we place an implant right there. But in a couple months they come down again for another implant. So now we are more focusing permanent solutions. So permanent solutions is if the level of the bone is like a 50 or 60% lost, we try to go something for long term, and that's mean go for the treatment on 4 or on 6. So that's very important, the diagnosis, because sometimes we are trying to save teeth because for sure that's the best way to go, but we are not heroes. So
Yes.
So
we can't do miracles.
So we sometimes we want the best options for the patients, but we have to be very sometimes drastic for the treatment.
Yeah, and he's very right. We have to because we always talk about with the patients the options. It's not like, oh no, we give them options and we give them our point of view of each option, and that's totally correct. We might think, well, the patient might think that we're going to give them crowns, as you mentioned, but it might only last a year, 2 years. Right. And it's also a financial decision. I mean, if we can do the treatment that you really need once, we do it. And that's only one time that the patients are actually paying. Because sometimes, as you mentioned, I did it myself as well. Well, we can try to, here and there, and then the patients would come back and, we'd be back to square one, which we needed to do a full arch treatment since the start. So, yeah.
But it has happened before also that patients come in for the full arch and you guys tell them, no,
right,
you have to go for crowns because we can fix it.
Yes.
So it's not that it just depends on case to case.
Yeah.
We've had patients that come in and say, I want to get this done. And you guys are like, well, you need it on the floor. And then they get mad and they leave because they feel like, oh, you're just trying to pull my teeth. But then they'll find out in the future that it was exactly what they needed. And we have the technology to be able to see that and be able to show it to you if you actually want to be actually open-minded about it and be able to see.
Yeah, and we're not butchers either. If the patient doesn't need it, we're not gonna.
Yes, no, we're not doing so.
No, we do full mouth restorations. We do a lot of full mouth restorations, each and one of us, and we have that as well. People come in because I don't want to struggle with teeth. Now I want implants. We're like, whoa, hold on. You're not a candidate. I mean, technically we can do it, but we're not gonna do it, right? We would rather. It's easier for us. It's easier for the patient. It's never the same to have implants with the full arch of implants than to teeth. It's always better to have teeth, but sometimes the teeth they're not going to last. So we have to make that decision with the patient.
And I think the only way to have those decisions is with experience, because if we don't have experience or we see, probably we can fix it, but the reality is experience gonna give the correct the correct way to go.
Yeah, and that's very true. I was watching some Insta stories from some of the doctors that we follow in the U.S. Dr. Bolton, I think he's in Indianapolis, and he showed a case, the story of he removed the temporary teeth, and 3 of his implants failed. 3 out of his 6 implants failed. You know, and it happens. Complications do happen. You know, and he's one of the instructors for Norris Medical, and he's like, well, guys, you know, this is the real dentistry. You know, it happens to him. It happens to us as well. The thing about complications, not just in dentistry, in life, they're going to happen. It's the way you actually approach the complications.
Yes.
If you have answers for those complications. And we have complications as well, but we're trained enough. We have the right experience and the right tools to move forward with the complications. And because we want the patients to know that as well. Like you might do everything perfectly, and, you know, something might not go as planned, but we have the backup plan, and we have plan A, B, and C to move forward from that.
Yes, and something very important, we never think as a salesman. It's always, we're looking the best for the patients. And also, we have a lot of work. We have a lot of patients here. It's not like one dentist who have like 1 patient a week and he want to try to sell you something. We have a lot of work. We have a lot of patients here. That's why it's easy for us, just say what the patient really need. And we're not just looking for something else.
Yeah, and I think that's been the keys to success to Supreme, that we're just and it's
100%.
and it's very transparent. I mean, you can talk to anybody. You can look at the reviews. You can talk to other
Right.
patients. A lot of patients come in for their first time, and they're in the waiting room, and they talk to another patient that's been here a couple of times, and that's when they fully like, oh, so there's someone that actually has been here. They believe in them. They trust in them, and yeah, it's fun.
Yeah, not always is doing the right thing for the patient the most money for us or the best for us. You know, it's we focus on what's best for the patient.
Yeah.
And like you were talking about foundations just this couple podcasts ago about when you do an all-on-4, how an implant's different than if you do a single implant or an implant with a bridge that do an all-on-4. You have to go deeper in. The foundation needs to be much larger.
Yes.
Right. And that's the foundation that we do with our patients. We do what's best for the patient all the time. And even by doing that, sometimes things go wrong. But we do it each and every time. And a lot of other clinics all over the world do what's better for them. And that we're not here for the short game. We've been here 17 years. We're here for the long run. We're here for when we tell you an implant is lifetime warranty. Well, it's lifetime warranty, you know? And so we want you to know that whatever we're doing, even if it takes longer, or if we tell you that things changed a little, or if it didn't, or whatever it is, that we're doing what's best for you. The patient also said, going back to the original patient in the morning, he said, you know, because word of mouth is the biggest marketing.
Yes.
And it's all about word of mouth. You know, word of mouth. We're here because of our patients. We're here because of our patients bringing us more patients. Well, you know, big shout out to all those patients that have been in our waiting room, that talk to other patients, patients that have met our patients up in
Airports.
at the airport. And without knowing, they start talking about Supreme. They're like, well, we're going to Supreme. Recently, one of the reviews that was put on that they said that if anybody wants to, they can reach out to him and he will let them know how great of an experience it was to be at Supreme. People that want other people to know how great it is to come down here and get work by you guys. You know, and that's what it's all about.
Yeah.
That's what it's all about. So anything else you guys want to say before we wrap up? You're about to go on vacation.
A much needed vacation.
Oh, get out of here. He's been gone. How many weeks have you been gone already? 4 weeks?
Training.
Yeah, trainings. Trainings.
Training in Mykonos.
You know, I counted. You're going to be gone for 8 weeks this year.
Yeah.
A week in Switzerland. A week in Brazil. A week in Mykonos. A week in
Singapore.
In Singapore / Tokyo.
/Tokyo.
Stop,
That's
bro,
4
stop.
weeks.
Pit stops.
And then your month vacation, and not all the pit stops that you did in between too.
Hard work.
Wow.
Hard work. I'm a hard worker. I am.
Patients are like, when is Dr. Elias going to be there?
Is he still working there?
I don't know, ma'am. I really don't know. I seen him this morning. I don't know if he'll be here tomorrow. And same to you, man. You've been everywhere.
Yeah.
You've been to Singapore. You've been to Mykonos. You're gonna go to Switzerland. You're going to New York. That's 4 weeks. You got another week extra off.
Oh yeah, that's true.
Because in the potluck,
That's
in the
true.
Christmas party, we raffled out weeks, and we raffled out weeks. I think that's the best raffle we can do.
Yes.
Like, what am I gonna do? I raffle $1,000. You guys gonna be like, oh, that's great, Frank.
Hard work.
But it's like, oh, a week, 2 weeks, 3 weeks.
We've earned this.
I think you won one day, right?
No,
Yeah,
Luis.
one day.
Luis.
Luis won one day.
Luis one day. Wait,
I got like 3 days.
we didn't know what the raffle was gonna be.
Yeah, well, it was a little punch thing.
Yeah.
It was a little punch thing.
We had no clue what the raffle was gonna be because it was doctors and then assistants, right? So we're like, what's the doctor's gonna be? Had no clue. And then the first one is Luis because we did it by order of who was here first. Luis has been here the longest, and like we have no clue what he's gonna win. And he punches it and he grabs it and he's like, what? 1 day free.
1 day off.
And we're like,
but he was excited.
no, we were all excited.
He was like, oh, Frank. Oh my gosh. Maybe we have video of that. I think I have video. You will have video. This is the Christmas party when we recorded. You know, we're doing the exchanges. Afterwards, we got this big old thing with holes on it, and you punch it, and then these will stick out a little thing. And they would be, we had one for the assistants that we did a PS5.
Charlie.
And a whole bunch of other stuff. And for the doctors, it wasn't gifts. It was
Day off.
extra time off.
Yeah.
And you got a week.
Yeah, I got a week.
What did you get?
I got 2 weekends.
You got 2 weekends, and then he
Alright.
traded a week.
Yeah.
He got a week a trade. That's crazy.
Yeah. But it was sad because Luis has been here the longest and he only got one
Just
day.
got 1 day.
And he got it at January. Remember it? You got it like
You got it January
Third or
second,
something like
to
that.
be gone or something like that.
Oh
But
well.
Luis is a robot.
Yeah,
He's actually
He's-
on vacation right now.
He's part of the furniture here.
Yeah, he's like boop boop beep boop.
he's plugged in right now. I have a picture. He's battery charged. I have a picture of that. Pa que lo pongas ahí del- He doesn't go home. He just gets like plugged into a wire and that's it. He's a robot.
Wow. Well, I don't know. I haven't seen that picture, but well, thank you guys. Thank you so much for being here, guys. I know you're gonna be gone for 2 weeks. I know that Dr. Spooky's really excited because he's flying to Switzerland. I know you guys have not. All 3 of you guys are going to Switzerland.
Yes.
All 3 of you guys and Dr. Mitch is
Yeah,
going to
Dr. Mitch
Switzerland
also.
together. So I expect cool
Good team.
little videos there.
Nice
Elias to
team.
Brazil.
Yeah, Elias is gonna go to Brazil.
Brazil.
You have to wear a parachute.
I have to be.
Oh yeah, he has. Wow. He has to wear a parachute. See why we can't have him just like for that? He needs to have some sort of filter because we'll get canceled, man. Well, we wish you the best. When I just go on a boat, man.
I know. I was just like, oh, I don't know, bro. I don't know.
Just drive.
Just drive up there. Yeah.
Just drive. Well, hey, I'm telling you right now. You guys want to say hi to anybody? Shout out to anybody?
To all the patients, man. To all the patients that are actually patient, you know, that been here, that trust us.
All the patients that are actually patients.
Yeah. Yeah, that believe in us and that believe on what we're saying and that they're here for a reason. And because all this hard work, all these trainings, we're not just, we're going to go have fun. Yeah, we do have fun, but we're actually there to learn. We're here from very long hours and we're always thinking about dentistry. Like yesterday I was at the gym and I was thinking about how am I going to deal with this case in 3 months, you know? And we put a lot of hard work in, and trust us, when we give you guys a diagnosis, a treatment plan, it's because we believe it's the best. And we've been to the best courses with the best doctors, and it's the best you can get anywhere in the world. So yeah, so I want to give a shout out to those patients that come in and they don't have doubts or not comparing. Well, you know, my doctor in the U.S. that probably hasn't gone to where we've been or don't have the specialties because they don't know how to do something. They question what we should do and we shouldn't do. And we're not going to do something that another doctor said should be done when we know it shouldn't be done. Because as you mentioned, we're not order takers. We have the technology and the experience and the courses to make our own decisions. And I want to give a shout out to those patients that truly believe on the Supreme Way.
There you go. Well, actually, we're going to do a podcast when you come back, and we're working on the podcast, and we're actually gonna name a couple of. We've been having this question a lot with patients saying, "Well, why do you guys do implants exactly after extractions?" Well, it's on certain times that we can, but why are you guys doing it if my doctor back at whatever state says you gotta wait like 3 to 4 months or 6 months and then get it done after? And we're gonna name different doctors in the United States that are top dentists, they're like top dentists, that these guys actually go to courses with them, and they meet them in Spain and different parts of the world that are doing the same thing we're doing because it works. Okay. So if your doctor back at home says, "Oh, well, you should wait," well, maybe you should go get a second opinion somewhere else, because obviously they are not up to those standards. And that's how I'm going to put it. But obviously we're going to get a lot more in depth when it comes to that. And we want to thank each and every one of you guys for being here. Talking a little bit about Elias. Thank you so much for our patients that do watch our podcast, patients that come in, day out, that say, "You know what? Thank you so much for what you guys do. We've seen your podcast. We really like it. George is ugly, but his work is great." And so just thank you. This is what this podcast was actually for you guys. You know, we never thought about being famous or anything. Maybe Dr. Mitch, you know, maybe someone gets them for like a TV series or something. But us, we're really happy. You know, we're really happy that you guys are. This is actually changing. And if for any reason you don't come to Supreme, you know, it's okay. Just wherever you go, you get what's right for you, and that's what this is for. So. Thank you for being part of Supreme Dental Podcast Studio, powered by Supreme Dental. And just like our patients, keep on smiling.
And if you don't know, now you know. Let the beat down in the house. Junior Mafia, Math Flavor.
I see you through the